Commissioner Barboa, you told me in an email that homelessness is among one of your priorities. How so? What does that look like?
You know, like I say often from the dais that I ran because of our behavioral health. And before I wasn't elected, I worked as an organizer, and that really we helped pass the behavioral health tax with my predecessor. Commissioner Hart Stebbins, my predecessor, took the lead with Commissioner O'Malley, and we were able to pass the behavioral health tax. And I was a community organizer at the time, knocking doors, saying why. And I know that voters voted for that in the 70th percentile, which means it was nonpartisan. And I know that because of my own experience, that if you grew up in New Mexico, you love somebody with your real heart that's been addicted to a substance. That is not because we are somehow subject to that because of our nature. It's because we are in this place, right? We've been in this place that our people have traveled north and south from across what now existing borders forever. And, through history, we're in this place now that we're right in the path of how drug supplies get to our country. So, we have multiple generations of this in our history, and including my own family. My father and 3 of my uncles passed from substances. And so I know that that all these things are integrated. They're intersectional, right? That housing, homelessness, our incarceration system, our behavioral health system, that all those things play a piece. And that's why we're really trying to build an ecosystem of care that addresses the needs where it's at.
Talking about that intersection with incarceration, the county oversees the Metropolitan Detention Center, the county jail. How does your approach to drug treatment, substance use relate to the MDC and what the county is doing there?
I mean, like I said, all of it is interconnected. There is no separating it, right? And so like 80%, I think it's one of the facts that we're trying to fact check, but about 80% of the folks inside our jail have a substance use issue. And so right now we're asking COs and law enforcement, officers to handle our behavioral health problems. We have a addiction treatment program in the jail that I'm trying to strengthen and build, because that's we need it in there, and we need it as they come out, right? Because that can't be the place. People need to have a safe, accessible place that they feel trusted.
Right, that handoff as people are leaving MDC to get them connected to
services.
And
we have a resource reentry center that we're expanding. When I came in, it was they'd actually shut it during COVID, but then they opened it, and the hours were from like 9 to 5, even though we knew the first drop-off from MDC didn't happen until 2. So we've changed that now. The Resource Reentry Center, where everybody coming out of the jail has to go through, is now open 24/7, and that means that folks who want to, we can't force folks to get help, but there's a charger there. They can get a snack and some coffee. They can let their phone charge, because often that's the need. But also there's case managers there that say, hey, if you want this service, that service, you need housing, you need clothes, you need food, you want treatment, we have it available.
And you talk about a strengthening treatment inside the jail. The majority of folks who have died while in custody at MDC have had substance use disorder, have been detoxing. How can the county support that effort to help folks navigate those withdrawals while incarcerated?
Yeah, this is why I ran, because I couldn't understand how we could possibly be letting people die in our care. And since I've become a commissioner, I pushed. The first thing I did was to see we were getting a new healthcare contract, which we pay bazillions of dollars for, millions of dollars for, right? One of our largest contracts is to provide healthcare in the jail. But forever, it was these national companies. I've learned that there's only about 5 national companies that really do a disservice to all our justice systems, like all our correction systems across the nation. So we were able, thankfully, work with UNM. Our previous county manager worked out a contract, and now UNM is serving. I mean, we still are seeing deaths. We're still trying to fix up that system. But I think having a local provider that we can hold accountable, that we know is going to see them on the ER side anyways, if they're not served in the jail, then we're going to see them in the ER, or we're going to see them at the psych ward, So yes, the fact that I think we're moving in that direction to improve those systems. We're all on it.
All right, thanks for that. Speaking about homelessness in the city of Albuquerque, Safe Outdoor Spaces has been on the docket of the city council already. There's opponents who would say that the regulations of those are too strict. The conversation about loosening those regulations failed on the city council. Councilor Pena, where do you see safe outdoor spaces plugging into supporting homeless Albuquerqueans, and whether they should be regulated at the level they are today?
The safe outdoor spaces, I think it's been brought up a few times. One of the times that it did come up, it came from some of our Democratic colleagues, that we needed to have more dignified spaces for people. And I still stand by that. You know, we spend millions and millions of dollars on affordable housing. And we're doing great work, both the city and the county. And just as the commissioner mentioned, we spent $80 million. It's a project that happened to be in District 3, which is going to go a long way to address some of our housing needs. But I really think when we're using these affordable housing dollars, we really need to get creative with them and help the most vulnerable in our community to create housing for people to have. One of the amendments that I had done in the past for affordable housing was to really create where we have a fund to fix houses in the community, right? So we need to do some of that. We need to have places where those affordable housing dollars needs to impact our most vulnerable.
Okay. And Councillor, way back in 2017, you sponsored the city's immigrant-friendly proposal, or expanding it. It had already existed, yes. and you helped expand it, reaffirmed it. The state this year passed a bill blocking counties and other local government cities from contracting with the Immigration and Customs Enforcement. I was told at the Roundhouse, in part of what changed, because that proposal has come up before, and it had died in the Senate. And part of what changed and allowed it to cross the finish line this year was witnessing what is happening nationally with ICE deployments, maybe specifically in Minnesota. When you are thinking about what's needed here in Albuquerque, what is your reaction to what's happening nationally right now? And is that new context for the city needing to do something different, something more?
Well, you know, Commissioner Baca was actually intending to put something forward last year sometime, decided not to because it just didn't seem, I'm not speaking for him, but it didn't seem like it was timely. Obviously, what's happened across the country just more recently has all of us who have been advocates for our immigrant community really felt like it was necessary. So myself and Councillor Baca, he's a sponsor, and I think a couple of other councillors are interested in sponsoring. So we're going to kind of mirror what the county's done, and then also we're adding in there for staging. So it's going to mirror the counties, but then we're going to add the staging component to it because we just want to make sure we have it in our immigrant friendly already, but we just really want to tie up some loose ends in terms of our parks and public spaces outdoor, because we have it really kind of now sounds like it aligns with all those things, but I think it's mostly for buildings. But now this would help so that, you know, they can't use our public parks, our city parks, to stage for, you know, ICE.
And Commissioner, the councilor is saying that they would mirror what the county did. Can you break down what the county has done and your role in that? Yeah,
thank you so much. Yeah, Commissioner Barbara Baca, because we have Councillor Baca, all the Bacas. Commissioner Barbara Baca and I co-sponsored legislation that passed around creating immigrant safe spaces. The county just reaffirmed some of that, and we're moving deeper into say, like, yes, in these public spaces, we want to name them because we have pictures of, we have judges in courts telling us there are people going into the courts looking for people and literally telling agents standing outside that that's who they can get. So they're wanting the help. We want to make sure that people accessing public services can access without fear. Otherwise, we're pushing them into doing black underground things if they can't safely access services, right? So
And we're going to ask businesses to actually post where the public spaces are and where the private spaces are, so that when people go to work, they know that they're safe.
Yeah, they're aware of what space they are occupying at any given moment. This is both of your last terms in your current role. Commissioner, you are termed out, and you're in your second term. And Councilor, I believe you've said that you're not running for re-election. If you are still in that place, then this would be your last term on the City Council as well. As you are in your last term and now have been elected to lead these different legislative bodies, I wonder if you could speak to what legacies you all would like to leave as a county commissioner, as a city councilor.
Yeah, like I said, I think, you know, I'm really not here for legacies, to be honest, but I am here, like I said, when I ran for office, it's because the ways that the need for behavioral health has impacted my own family and my own communities. One of the things I'm most proud of is that I got in and we created the behavioral health ordinance that creates the Behavioral Health Authority division, which, and it has its own deputy county manager. And, you know, before we were under a big umbrella of public safety, which includes fire and our jail and our, you know, and obviously the behavioral health need throughout our county, throughout our state, but throughout our county is greater and needs that kind of focus. And that's meant that now I believe we're working in true partnership with city, county, state, University of New Mexico as a research and provider institution to really create a system of care. So yes, for me, if I left and knew there was a functioning system of care that met our families where they are at and with what they need, that is using that evidence-based, but also our cultural, we are very smart here in New Mexico. We know what our families need, and that doesn't always come through a clinical social worker, right? We need entry points that work for our families, that are culturally relevant, that reach our spirituality, that reach our various cultural identities in the state. And so, yeah, if I left with that system in place, I would feel like I did the job that I came here to do.
Councilor Pena.
Again, District 3, you know, underserved community, marginalized historically, all the things, you know, people coming in from a 30,000-foot view and feeling like they, you know, without living there and knowing our struggles, feeling like they know what our community needs, you know, without sitting at the table. I'm very much of the having conversations with your elders. I feel like if you don't learn from your elders, you're going to be forced to repeat the same mistakes that you did in the past, right? And so our community, you know, we needed a community center. We had only one community center. The community built the Alamosa Neighborhood Community Center, and then we built the Westgate Community Center, serving an entire, if you look at the population of District 3 and the population of Northwest Albuquerque, with the county, it exceeds the Northwest area, but yet we lack many of the things that they have there. So building the Westgate Community Center, building the Southwest Public Safety Center, building 4 new parks, another one on the way, just trying to really meet the basic needs in the community. I'm very proud of that. And we have, you know, other things that we're looking at, like a multi-gen center in the future. So I'm hoping to be able to finish that by the time I'm out of there. And, you know, so I'm very proud of that work. And new street lightings when we didn't have lighting in our streets, you know, to have new lighting, more on the way. I think those are really game changers in our community. And you can see it by just driving the community.
We know that South Central has been not invested in, and I'm Southeast Albuquerque, she's Southwest Albuquerque, and so I'm really excited about the opportunity that both of us, South to Central, can lead, and we can make decisions that really impact our community for generations to come.
Thanks for adding that.